Hi guys, this is Dr. Wasim Khan from Your Family Doctor, and today I'll be discussing lupus, which is a medical condition where the immune system of the body starts attacking its own self. I'll also discuss Selena Gomez and Nick Cannon, which are both famous celebrities, which I'm sure we're all aware of, as well as then discussing lupus in a bit more detail. So let's get straight to it. So Selena Gomez first revealed that she had lupus sometime in the year 2015, and following on from this period, she described episodes of weakness in her hands, and as a result of weakness in her hands, she was unable to pick up or even squeeze small objects such as an orange or a lemon. She also describes chemotherapy as being one of the main modes of treatment for her condition, and sometime in the year 2017 she received a kidney transplant from her best friend Francia Raisa because the lupus was causing kidney failure. And recently she had some of her fans worried as she showed a picture of herself with an IV line or an intravenous line stuck in her arm. Nick Cannon is also another famous celebrity, which I'm sure we're all aware of, and he describes a slightly different picture of how lupus has affected him. And he particularly describes weakness and paralysis in the muscles of his body, especially in the mornings, which can take sort of anything between 45 minutes to an hour to recover from. He also describes being admitted to hospital with life-threatening events, again due to lupus, and these included embolisms or clots to the heart and the lungs. He particularly describes his main mode of treatment being with steroids and chemotherapy. So now let's just have a look at two videos, one from Selena Gomez and one from Nick Cannon, which describes their journey of lupus.
Have been struggling with you were diagnosed with lupus and that you went through chemo.
Yes.
Is that right?
Yes.
When did this happen?
3 years ago. And I think it was just very complicated because I didn't understand, and then that was something I did want to keep private until my whole life suddenly wasn't private.
Right.
So I just kind of it was my moment. I'm really honestly I'm able to relate to people. And I get it,
And what is, I don't know what lupus is. What is it exactly?
It's an autoimmune disease. So.
And do you still have it or what?
Yeah, you'll have it forever. It's kind of one of those situations, but you just gotta take care of yourself.
Well, that's a good thing to do anyway. So
Yeah.
I'm glad you.
Lupus is the episodes or the flare-ups. Your system, your blood's not functioning properly, and it's like a bubble that gets in your blood, and once that bubble of air gets to your vital organs, it's usually over. And I've had, since my battle with lupus, I've probably had almost a half a dozen pulmonary embolisms. I remember the initial one, which we found in 2012, was 3 at once, where I had them in my lungs and one even in my heart. Usually when those get to that place, it's over. And I've had doctors look at me in my face, man, we don't know how you're still here. Like, you've arrived too late.
Okay guys, so those were two videos, one from Selena Gomez and Nick Cannon, describing their journey of lupus and how it's affected them. Now I'll talk about lupus in a bit more detail. Okay, so what is lupus? So lupus is a chronic autoimmune medical condition where the body's immune system becomes hyperreactive or overreactive, and it starts attacking normal tissue. So it can cause damage and destruction of the kidneys, the liver, the brain, the eyes, the spine. It can actually attack any system of the body. And why this happens, researchers and scientists, they don't exactly know. Researchers have postulated that it may be due to genetic factors, so it may be due to changes in the genes or the DNA. Some say it runs in families, and certainly there does seem to be an association with when you're dealing with patients with lupus, you'll often find that there may be a family history. Some say it can be due to certain drugs, and certainly it does seem that some drugs seem to bring the condition on. There is also an association with a certain viral infection called Epstein-Barr virus, or EBV, which also seems to be associated with this condition. It tends to affect women more than it affects men. It tends to occur between the ages of 16 to 55 years of age. When it occurs in men, it tends to occur at a later stage, and it tends to be a bit more severe. In terms of the symptoms that lupus causes, it can cause a butterfly-shaped rash on the face, as you can see here. It can also cause painful joints. It can give you a headache, weakness, fatigue, weight loss, hair loss, as well as a variety of other symptoms. Particularly in some women, lupus can cause a separate condition called antiphospholipid syndrome, and in this condition, women present with recurrent miscarriages and blood clots. Okay, in terms of the management of lupus, the first thing we have to remember is that lupus is a chronic condition. It's not an acute condition. So it's something that you'll have for a long time. It can't be cured, but you can only control it or suppress the symptoms as much as you can. Now, what I mean by this is, okay, for example, if a patient has a tonsillitis or a bacterial throat infection, you can give the patient antibiotics and this will be cured. However, lupus is not like that. It's a chronic problem, okay? So the aim or the management of lupus is to try to control the flare-ups, any acute events such as blood clots, which can develop to the heart and the lungs, as well as some other acute problems that can develop, as well as trying to manage or controlling the day-to-day incapacitating symptoms, as Nick Cannon described very well in his video. So in terms of managing this condition, especially in the initial stages, your GP or your family doctor may advise you to go into a certain exercise program which is specific for lupus, which tends to help the day-to-day symptoms such as bodily pains and weakness and fatigue. They may also start you on anti-inflammatory painkillers to help you with the painful joints, and some of these painkillers may include ibuprofen, naproxen, and diclofenac. You will also be advised usually to stay away from direct sunlight, as it can sometimes worsen your symptoms or bring upon flares. In some cases, you may be started on low dose to high dose steroids and drugs which are specific to suppressing the immune system, because if you can imagine, the immune system is overactive, so you need something to dampen it down, and medications such as methotrexate or azathioprine can be started. Now, in more complicated cases, and I think Selena Gomez probably falls into this criteria given her history of a kidney transplant, you can give high dose steroids or chemotherapy such as cyclophosphamide through an IV line or an intravenous line through the vein. Now, you might say, so what's the point of this? Okay, it's a more severe case, but why is it severe? Now, if you can imagine, the immune system is overactive in lupus, okay? So sometimes when it starts affecting the organs such as the kidneys directly, there's a lot of inflammation around these kidneys. So you need this high dose steroids or chemotherapy to rapidly reduce this inflammation around the kidney, and therefore to prevent any irreversible damage. In terms of the long-term goal or the management of lupus, a patient will usually be followed up by a specialist called a rheumatologist who deals with the inflammatory conditions of the joints, as well as other conditions such as rheumatoid arthritis and other conditions where inflammation is a main cause. The other important thing to notice is that a patient will need to have regular blood tests. This can be 3 monthly, 6 monthly, or yearly. This will be decided upon your GP and your rheumatologist and how the lupus is affecting you. So you may ask, what's the point of having these blood tests? So lupus not only affects the organs, okay, it can affect the blood itself, leading to anemia. And also the drugs that are being used to treat lupus, okay, so we're in a bit of a catch-22 situation, or a double-edged sword. So although you're trying to benefit the patient by giving them these strong immune suppressing drugs such as methotrexate, etc., they can also cause side effects, because they can suppress the immune system so much that it can start damaging the kidneys, the liver, and causing problems with the blood itself. So we're in a catch-22 situation, so you don't want to tip the balance of the scale on one side too much. So the blood tests are quite important. Hi guys, so that was the end of my video on lupus, and if you want my opinion of how I think lupus is affecting Selena Gomez, I think she's on the more severe end of the spectrum, and I think this is quite obvious from the kidney transplant that she had sometime in the year 2017. And she also showed a picture recently with the IV line and intravenous line stuck in the arm, and I can only assume that she's been having high dose steroids or perhaps chemotherapy through this line. In terms of how lupus is affecting Nick Cannon, it's interesting because usually in men the symptoms tend to be a bit more severe, but it seems that Nick Cannon is managing his condition well, or it seems to be. And his symptoms are also slightly more different compared to Selena Gomez, where he describes weakness and paralysis being a main component of his daily struggle with lupus. Okay guys, please leave any comments in the comment section below what you thought about this video, and if lupus affects you, please mention it in the video below, and of how you tend to manage the condition. And if there's any other conditions or medical problems you'd like me to talk about, please mention it in the comment section below. Thank you.